our next segment, we're going to start now and move forward into that, and that's going to be our panel discussion. And I'd like to introduce to you our panel speakers today. And first we have Rajiv Nathan from Brockman Logistics in India. We have Mike Folds of Sunbury Warehousing Logistics in the UK. And we have Robert Hoops of Share Logistics in the Netherlands. Welcome, gentlemen. Thank you very much. Appreciate your time. I'd like to start off first by giving you the opportunity to just introduce yourselves and your company and what you're doing in the pharmaceutical niche. So we'll start with Rajiv. Please go ahead.
Hi, hello everyone. It's nice to see you all again in the second virtual conference. And my name is Rajiv Nathan, and I work for Brockman Logistics. It's a Netherlands-based company, and we have been in India for the last 33 years. And I've been with this company for 27 years. We have 15 offices and 200 staff. We do all kinds of freight forwarding activities and specializing on pharmaceuticals and temperature control warehousing in Bangalore. And this is just a short introduction of our company. And look forward in having some good business transactions with all of you all on the pharmaceuticals. And looking forward to meet you all next year.
Thank you very much, Rajiv. Mike, please go ahead.
Hi, I'm Mike. Company Sunbury Warehousing Logistics, based near Heathrow in the UK. We've been working and trading for about 7 years. Our directors have more than 35 years each experience with pharmaceuticals. We have an ambient temperature controlled warehouse here, direct access to all ports and airports around the UK, and we are used to handling imports and exports of all forms of pharmaceuticals. We do a lot out to Africa. We import from various parts of Asia, and hopefully we're looking to use Like Logistics to help us grow, but give yourselves also another option here in the UK if someone can help yourselves with what you need.
Thank you very much, Mike. And Robert, thank you for joining us and agreeing to jump into this panel so soon. So nice to see you, and please introduce yourself.
Yes, well, thank you. Well, my name is Robert Hoops, responsible for the pharmaceutical shipments, pharmaceutical logistics within Share Logistics. Share Logistics is a large company with several locations all around the world, but mainly all pharmaceuticals are handled via our office in Amsterdam. Sea freight, of course, via our office in Rotterdam. We ship all kinds of pharmaceutical shipments, medical tests, a lot of them at this moment. We send them all around the world, well, to every little island. I'd rather go there than be there, well, when you are sick. Next to medical tests, we send vaccines, we send vitamins, medical devices, very large medical devices for operations in hospitals, and also those we can send them all around the world. At this moment, and I think that counts for everyone who's in the pharmaceutical business, it's very, very busy, and we are, to be honest, a little bit short in staff, because there are so many requests to send all kinds of things around the world.
Very good. Thank you very much. We'll start with our first question, and this one is, how do you believe that the Delta variant, which has so affected the world, how do you believe that this is going to affect the reopening of the world? And I'd like to start off with Rajiv. Oh, we can't, we've lost your audio there. Can you, are you there? I think you've, yeah. We'll move on. I'll come back to you, Rajiv. We'll get your audio working. Mike, can you go ahead and let us know how you think the Delta variant is going to affect the reopening of the world, and maybe specifically the UK?
I think it's going to have quite an impact. It's going to be a phased impact and reopening in spits and spurts. In the UK, we are now seeing a possible deviant of the Delta variant, which they're calling Delta Plus, which could delay things. Although we are technically allowed to do everything we can, we are still looking to wear masks, still looking to use antibacterial spray, etc., where we can. And I think that is how it's going to be. Everybody is going to be slightly differently affected depending on how things are at the time. I think the virus is going to have smaller peaks and almost be like aftershocks in an earthquake, and it's going to take a long time before it fully goes away.
Robert, how about you? What do you think?
What do I think? Well, I think it's a very tough question. We now have the Delta variant. What do we have next week? I think it's very important that that we all, all as we are here, and also other countries, that they will make sure that the people get their vaccines. And there are a lot of countries in Europe who are very, how do you say? They have vaccinated a lot of people, but in other countries, in Asia or in Africa, a lot of people are not vaccinated. And the longer this will take, the longer it will take before we get out of this whole pandemic. So it's very tough.
Yeah, hard to predict. Rajiv, maybe we can hear you now. I'm not
Yeah,
sure.
you can hear me now.
Perfect.
Okay. As far as the Delta variant is concerned, when concerning to India, I think the second wave of India was where the Delta variant was very contagious and better, worse than the previous variant. And it was a tough time for India. But currently, I think India has done well with the size of the population we have. The governments, the union government and the state governments have done really well in vaccinating at least 70% of our population by now for the single dose. And the second dose, I think we should complete by December or January. Yes, there are some states where it is a little bit slow of the vaccination because some people are still concerned about the vaccination. But I think basically the vaccination has helped the people to at least not to suffer as what the unvaccinated people are. So I don't know how things are going to be, but looking at the festival season and things opening up in India, I'm keeping my fingers crossed and hope we can just sail through.
The next question I've got is regarding the management of the pharmaceutical freight space in this time. How are you managing the freight space in the current situation in these current times? It's got to be a challenge. And what is the most challenging aspect for you in handling the freight at this time, the pharmaceutical freight? And this time we'll start with Robert.
Well, for my department, I do not really have problems, and that's because the pharmaceutical companies, they want to have the space and they want to pay for it. And for instance, normally I paid about €1 per kilo to ship something to Mauritius. And at this moment, I have to pay about €30 per kilo. But the pharmaceutical company, they want to have their products over there, and they're going to pay it. So when I pay these amounts, I will get the space of the airlines. That's mainly what's happening with my customers.
That's thank you. I'm glad to know that you're not having an issue there. Rajiv, how about you?
Yeah, there is a lot of constraint as far as getting the freight space during these times, but somehow we are managing to satisfy our customer. Yes, he's willing to pay a little more than what it was, not little more, I would say, very high prices also. But we have some good rapport with the airlines, with the liners and NVOCCs. So we are able to provide some solutions to our customers, especially our pharmaceuticals. And I think we are doing quite well. But looking forward for things to settle down a little more better for everyone.
And Mike, how about yourself?
It is a struggle. We are still booking the space we need both for air and sea, but we are quite lucky in the fact that we have a couple of contracts with lines where we have a priority service, which we have used. And airlines, as Robert said, it's basically, if you're willing to pay for it, you'll get the space. So pharmaceutical contracts with the airlines, it is happening. We're just trying to book as much as we can early, and where we can, we are booking a volume weekly in any lanes which we've got reasonable volume on, and therefore we have space already in place at a lower rate, even if it's, you know, not all of what we need for that week, and then we're just scrambling to fill the last ones. So it's booking it early and being prepared to pay a higher rate.
Okay. Bringing this discussion full round to the network itself, I'll frame this question as how valuable is the Pharma Freight Network in developing your Pharma Freight business, and how do you use your membership, or do you use your membership when you're selling to your pharma clients? And we'll start, Mike. I'll just come right back to you and see what you have to say on that.
It is very valuable. We deal with a lot of partners and customers who want to know that we have similar partners worldwide. They want us to be confident that service we can offer here in the UK is mirrored elsewhere in the world, and they want to know that what we have is a reliable service. So we do use it as a selling point. We make sure it's made aware to the customers when we're visiting them, when we're looking for new customers, and when we're working with new customers, that we do have this network and that it's there available, and we can offer more than others can because of that often.
Okay, thank you. Rajiv, how about you?
Yeah, in fact, nowadays, other than those freight networks, specializing in a particular commodity is the thing. And I think we are doing quite well. And as far as the Pharma Freight Network is concerned, our membership is about 4 years old and we're developing well. We have the GDP certification, required certification. We do inform all our customers about our membership with Life Logistics, saying that we have the other side, our Life Logistics member who's also specialized in pharma. So that is an added advantage when we sell to our customers these solutions for their pharma. I think it's a heads up for us.
Excellent, excellent. Glad to know the tool works. It's a good tool for you. Robert, how about yourself?
A good network is very, very, very important. And especially when you have partners abroad who know the business you are dealing with. So you have to rely on their expertise. And well, in the beginning, you have to audit them when and where possible. And then you can use them for several things. For instance, a lot of airlines postponed flights to several destinations. And when you have a good partner in a neighbor country of a destination where you have to send a shipment to, maybe you can find another solution together to get the cargo at the final destination. So that's really important that you have a very, very good network. Well, how about yourself? You are talking to a lot of companies in our network. And what do they say about the importance of this network?
Precisely what you gentlemen have said, that specifically talking to the clients and letting them know that there is somebody on the other end that's going to take care of their business the same way you would, that has the expertise that you work together with. And it's not just from an A to B perspective, but it's from A to B to C to D to Z, that it can move any direction. It can be a triangle shipment, whatever you need it to be, and that you're going to have the partner, the right partner at the other end, who will take care of your client's freight precisely the way that you would handle it. And that gives the client some peace of mind. And that's the discussions that we have, and the members believe the same thing. And that's one of the key reasons that we have this alliance, is because we believe the importance in the pharmaceutical industry to have partners who can handle it properly at each end. Makes your clients more relaxed when you hand them the shipment, when they hand you the shipment.
Yeah.
So no, thank you for asking. The last question that I've got is, COVID changed the way that we work, changed the way we work all the way around the world. And much of it became necessary to have our staff work at home, management work at home, sometimes nobody in the office. How did that affect you? And do you think that this remote work will continue as we head into 2022 and beyond? Rajiv, let's start with you.
In fact, it was like a shock for us when we had the lockdown and we are forced to work from home. It was very challenging for me to understand how this is going to work, because we are in the service industry. But we did manage, and we also found out that there is a way to find solutions even working from home. And I think our country has also taken this quite strongly, because nowadays we have faceless or you can say contactless deliveries, or the customs and other things which really help. But 100% we can't work from home, because a few of our staff have to be in the field. That's very important. But I think we are moving towards more of working from home. And staff have also put in a lot of efforts where they never looked at 8-hour shifts or 9-hour shifts. They worked almost 24 hours during this time. And I think in the future, remote working from work will be there. May not be for all the industry, especially for the service industry, but we have found ways that we can still work from home, at least for certain management levels or for certain staff, which we can do it. And it has been quite successful. A lot of new things we have learned through this COVID. This is one of them.
Mike, how about you? How have things been working in your company?
We've come to basically a hybrid way of working. We work a couple of days in the office and a couple of days from home. We have 2 teams, which we will probably stick to. So half of us are a team A, half of us are team B. Normally only one of those teams is in the office at any time. Therefore, if we do get a COVID infection in the company, fingers crossed, worst case, it would only affect half the company, and the company will be able to continue. So we have a contingency plan involved with that. We also have people who can work from home easier. So they do, but as you can imagine, working in people's homes, I'm quite lucky I have an office set up, and so does my wife at home, in separate rooms, but other people can only work on the end of their bed or on the kitchen table, and it's not quite so flexible. So what is being offered is a flexibility that if people need to work in a remote office, or even a small room in an office complex, that is an option there. But it is a case, I think, that hybrid working will continue to some extent even after COVID goes away. And I think the whole country has adapted. To be blunt, shipping lines have been the slowest of a lot to adapt, but they have now begun to pick up and deal with the responses needed. But it has taught the country a different way of working, in that you do not need to be sat at your desk 7 hours a day solid. If the work gets done, it may need to be between 6 in the morning and 10 at night, but with splits and spurts and gaps for you to do other things. But you can do the full-time job without being sat at a desk at a computer all day.
Yeah, I think that's how I see it changing. Also here, where I am in the United States, a lot of that is the same thing, where there's a whole shift about working. Robert, how about you?
First of all, I hate it to work from home. I want to be at the office.
Everyone's different.
There, there are a lot of companies in the Netherlands who are now get used to work from home. And I believe that in our kind of business, it's quite difficult because yeah, you have to arrange a lot of things. For instance, when you have to do some repacking, people have to be at the office. But for the salespeople, it is possible to work from home. But I think that in the future, it will stay like it is right now. Some people work from their home office, be at the office for several days a week. And other people will stay working at the office. In our office, everybody is vaccinated. We had an issue last week when our general manager was infected with COVID-19. And well, he stayed at home for several days. He was a little bit ill. He could work a little bit from home. But now he's at the office again. And I think it will stay that we have to work like this also in the future. We will have to see. But it's a very good opportunity to work from home.
That's true. That is true. Well, that's going to wrap up this segment of our program today. And I want to thank all of our panelists and for your participation. This discussion has been very interesting, and your valuable input, I think, is very important for all of the members and all the attendees here today. So thank you very much for your time. I really appreciate it.